I chose to participate in the IMPACT-RN experience because I think it offered something that we wouldn't normally get as part of nursing school. I grew up in a small town in South Dakota, and I knew that I have a passion for rural nursing and I might want to go back to that someday. And I really wanted to see what all a registered nurse can do in a rural area, and more specifically in primary care. A lot of times in nursing school we see the hospital side of things, the more acutely ill patients, but it was really great for me to get to see what it was like when you have those patients coming in for their clinic visits and all the background things that happen. Being part of IMPACT-RNS program, it really showed me the value that a registered nurse can have in primary care practice and what things you can really do with your scope of practice to serve that community and the patients living in that location. IMPACT-RNS program helped me to see the full scope of what a patient's care can be, from primary care in the clinic setting all the way to hospital care as part of the other clinical experiences at SDSU. So I think for me, I was able to see the background of what happens when a patient comes in to see their primary care provider and the value that that nurse has visiting with them. And I was able to see how insurance works and all the background things that happen that we don't realize just from seeing hospital experiences. So it's great for me. I feel more well-rounded after being part of the IMPACT program, and I feel like I can better serve my patients because I was able to experience the primary care side of things. So as part of the IMPACT program, I feel like I was able to see a lot of things that I wouldn't normally have seen just as part of the College of Nursing. A piece of advice I would give some students that are considering applying for the IMPACT program would be to just apply. You might think, oh, I might not be interested in primary care, I might not be interested in that side of nursing. But I can tell you that I feel like I gained so much. Being part of IMPACT has really been a valuable experience for me in my years at SDSU. I was really excited to apply, and I now feel like through my experiences that I gained, I can better serve my patients and know what it's like to take care of a patient all through their care span. As a bachelor's prepared nurse in a primary care setting, I think another value that they have in serving their patients is the background that they have from their bachelor's program and knowing how to assess the patient, how to quickly see things that might be a little off, things that maybe need to be addressed by the primary care provider, and doing that quick assessment and also getting to sit down with them during their clinic visit and really just figure out how they're doing and providing that holistic care all the way from their mental health to maybe the disease, the long-term disease that they're struggling with.